unless you fall under one of three categories. And speaking of, what in the name of weird videos on TikTok is happening in doctors' offices?
This was my doctor. This was my doctor.
Seriously, that's a thing. But why?
Well, just tell me where the invisible room is. I mean, I'll go there. I want to be invisible.
We head back to Salem, where tents are still banned, and soon sitting could be a no-no too. That said, remember all those shelter beds the city promised months ago? That still hasn't happened. So what's the deal?
That's a great question for council. It's a great question for our mayor.
And if you already filled out your ballot in Washington, but your candidate just pulled the plug, can you change your vote? And yep, Dan is still gone. So you're stuck with me. Here's the story.
Oh, that's so nice. I hadn't seen that yet. Welcome to the story without Dan Haggerty. Graphics, I was going to say graphics pending, but graphics here, man. Our evil plan to let Dan enjoy his vacation seems to be working. So here I am. I'm Maggie Vespa. I'm so grateful you're here. And in case you missed my little spiel last night, don't worry, Dan's on vacation. But this is still the same show. And we still want to have a conversation with you throughout it. So use the hashtag HeyDan or Hey Maggie if you want to. Reach out on Facebook, through email, even call us on the phone. We want to know what you think, and we'll really try to answer your questions later on in the show. In the meantime, we are going to start with something a lot of you do have questions about, and that is, of course, coronavirus. I'm sure you're not shocked. So first off, here's what we know right now, especially locally. 9 people have died in Washington from this disease, and most of them had underlying health conditions. These are the only deaths reported in the U.S. so far. 27 more people in Washington have tested positive for the virus, and a lot of them are associated with an outbreak at a Seattle area nursing home. In Oregon, 3 people have tested positive. 2 of them live in the same Washington County home, and the third is from Umatilla County. So if you're feeling sick, should you get tested for coronavirus? Well, it turns out it's not that simple, because right now Oregon is following the CDC guidelines, which only warrant testing people who fall under at least one of these 3 categories. Number 1, those who have traveled to a country where the virus is frankly spreading quickly. Number 2, those who are showing symptoms and who have had contact with someone with the virus. And number 3, people who are hospitalized with severe symptoms and other illnesses have been ruled out, like the flu. And we have also, as you know, talked a lot about the patients and their families, but we also want to talk a little bit about healthcare workers, because right now they're on the front lines, and obviously they can't afford to get sick. We can't afford for them to get sick. So Kyle Laboshi looked at what's being done to protect them, and is it enough?
In Hillsborough, a handful of doctors and nurses have been told to stay home for 2 weeks after potential contact with a patient who tested positive for coronavirus. It's just a precaution.
And we learned tonight dozens of employees at Kaiser Permanente who came in contact with those patients are being told to self-quarantine at home.
But for those hospital workers, there may be more to the story. I exchanged emails with one of the healthcare workers under quarantine. They wanted to remain anonymous, so no names. The employee had concerns because for several days, that patient was in a room with no isolation procedures. The worker felt like there weren't enough protections for the employees. They also said the hospital should have done a better job notifying those workers that they may have been exposed.
Kaiser Permanente released a long statement. In it, the healthcare provider said it's following CDC guidelines and working with the Oregon Health Authority to implement procedures and protocols that'll reduce staff impacts should we begin treating additional patients. Similar concerns have been raised elsewhere around the country. The LA Times reported anxiety is mounting among U.S. health workers on the front lines of the coronavirus. Healthcare providers in Northern California and Washington have contracted coronavirus from patients, which is not that surprising. Medical workers on the front lines of an epidemic often make up a disproportionate number of cases because of their close contact with sick patients. Which presents an interesting and important question. Is enough being done to protect these doctors and nurses in the workplace, like a hospital?
My name is Adrienne Inghouse. I'm a registered nurse and the president of the Oregon Federation of Nurses and Health Professionals.
The union representing many of those healthcare workers in Hillsborough says it's become increasingly challenging to monitor the shifting recommendations for treating coronavirus.
The CDC is changing and changing and changing what we need.
Union leaders are talking with their members, medical workers, to ensure they have the equipment and the resources they need, but admit it's still very early.
Our entire career, we've been walking into rooms where we didn't know what we were walking into. That's the nature of our work.
These doctors and nurses rely on safety guidelines from the federal government for treating patients and to prevent exposure to the virus among themselves and their coworkers.
There's been a lot of focus on equipment, masks, and medical supplies necessary to combat the coronavirus. But the unions representing health workers say we should also be talking about staffing levels. If enough people on the front lines get sick and have to stay home, somebody's got to fill in.
All right, Kyle, thank you very much. And staying with that very serious topic, we turn now to TikTok. Seriously, if you don't know what that is, though, find the nearest preteen and then ask them. But honestly, we saw a video there that speaks to staffing levels in doctors' offices, like Kyle just mentioned, especially amid this outbreak. And to be real with you, we didn't really know what to make of this at first, but tonight we vetted it. We can tell you this is real.
I just got home from the doctor and I have flu and cold-like symptoms, and this was my doctor. This was my doctor.
There it is. That video has been watched more than 2.5 million times. As you can see, that woman didn't get to meet with a doctor in person, but she talked to one on a screen, complete with scrubs and a stethoscope. And by the way, that was in Washington State. So we asked Kaiser Permanente about this, and they say they are piloting these telehealth screens in Seattle, and they're actually using them for patients who don't have severe symptoms or a complex diagnosis. So in other words, it's not that doctors are afraid of getting sick. It's not that they don't want to be in the same room with you. This just lets them talk to more people in a shorter amount of time. Kaiser also says this has been, in their words, very well received by patients. And right now, they're just not using them in Oregon. Again, it's only Washington at this point. And then finally, if you have Blazers tickets, don't worry. Right now, they're not canceling any games or altering plans because of coronavirus, but do not touch the players because the NBA has directed players not to high-five fans or sign autographs. And actually, after the first case in Oregon, CJ McCollum tweeted he's taking a break from signing anything until further notice. Hey, now to our big story tonight. It's one we and I have been following for months, and it's become nothing short of a saga about the city of Salem, its attempts to tackle homelessness, and a series of bans, programs, and promises, one of which the city flat out broke. Now, all of it is tied to Salem's attempt to clear downtown of homeless camps, something the city says business leaders desperately want. But months into Salem's efforts to clean up its streets and in the face of these promises to help its homeless, we wanted to know, has any actual progress been made, or is Salem stuck? And a warning, some of what we found is graphic.
Oregon's capital city, where laws are shaped and change is made, assuming elected leaders don't walk out. But don't worry, we're not talking about that right now. We're focusing on what's happening blocks from the state capitol in downtown Salem. First things first, let's rewind a few months. In December of last year, citing public safety concerns and complaints from business owners, city leaders decided to tackle the most in-your-face facets of their housing shortage by banning camping. For reference, this is what downtown Salem looked like at the time. Suddenly, the homeless people lining these streets in the dead of winter were warned they would have to give up their tents. Some protested and moved to the Capitol Mall.
We want the city to hear us, and we want our words to matter.
It didn't work. The ban on tents passed that same month, along with a big promise to add 140 shelter beds by the new year. Fast forward to January 2020, another city council vote to launch a car camping pilot program. Basically, it opened the door for willing property owners to let people living in their cars park on their land. Fast forward another month to February 2020. Council members drafted a new ordinance known as Sit Lie, one that, if passed, would ban people from literally sitting or lying on the sidewalk during the day. Salem has tried this before, and the legality of it has been challenged in other cities. But city leaders here promised to only enact it if and when they find shelter space for homeless people. They hope that makes a difference, and they've said they'll discuss the issue at their next council meeting on March 9th. So, our question: is any of this working for anyone in Salem?
All right, so we're back in downtown Salem, and I guess if I'm being real, it looks the same.
Last week, just like last month or even last year, homeless people lined the streets of downtown, just without tents.
The fact that I can't put up a tent and I can't disclose the things that I own.
This man woke up soaked in someone else's urine.
My pants are, my shirt and everything all smell like urine. Bad. It's terrible.
Business leaders say nothing has changed.
What are sort of the list of complaints that you've heard?
Hazel Patton of the Salem Main Street Association.
You can be graphic.
Okay,
I assume
I'm going to say I'm going to be graphic. Their stores are becoming bathrooms. Their entryways, they have feces, urine. They find people having sex. They find people masturbating.
What Patton is describing is basically what city leaders cited when they took away the tents, promised the beds, and so on. The problem? Of those 140 promised shelter beds, the ones that were supposed to open up by the new year, the city has only opened 10. City leaders blamed a communication error with community partners who agreed to host beds and then backed out. And as for the car camping program, no property owners have stepped up to let people park on their land. So that's not having an impact either. Patton says she appreciates that the city is listening to business leaders, but
if you had to give them a grade, A through F.
The council?
Yeah, the council. What would you give them?
I'd give them a C.
C?
I think their heart is in the right place. I think they're just overwhelmed with all the issues that they have to deal with.
She's hoping come March 9th, council members will announce they've found a shelter space, giving people here somewhere to go.
Well, just tell me where the invisible room is. I mean, I'll go there. I want to be invisible.
So I reached out to the spokesperson for the city of Salem, basically letting her know that we wanted to come here again and do an update on these ordinances. And after a couple of days of radio silence, I got an email back basically apologizing and letting me know that no city staff would be doing interviews on this topic until after that March 9th city council meeting.
Because anything can happen at March 9th, you know.
But feet from that spokesperson's office, we did manage to meet with one person from the city.
Great. Thank you so much for doing this.
Thank you.
Vanessa Nordyke couldn't give us an update on what to expect March 9th. That said, her perspective on the problem is unique. She joined the Salem City Council just 4 months ago.
And I parachuted into what I consider to be a crisis years in the making.
According to the last census, the city of Salem has a population of more than 173,000 people. Advocates say the number of homeless people here has been rising for years, and they estimate it's close to 1,800 now. And while cities up and down the West Coast are grappling with this issue, Salem is missing something crucial, something that cities like Portland have: a low barrier shelter. It's a place where people can come in drunk or high and get a warm bed.
Yeah.
Nordyke, who grew up here, pitched in its place, opening a park downtown to people with tents.
I always wanted a designated area for camping that was safe, that was secure, that was clean. But unfortunately, there just wasn't enough support on council to do it.
So with no park, no car camping options, and almost no new shelter beds, aka nowhere for these people to go, we asked, why is Salem sticking with its ban and even moving forward with sit-lie?
That's a great question for council. It's a great question for our mayor. I know where I stand on the issues. I am 1 vote of 9. And my vote was to create a designated camping area that was safe, secure, dry, clean, with access to bathrooms, and it did not take effect.
The only thing Nordyke says everyone agrees on here, this isn't working. Despite that, she agrees, based on what you see on the city streets, Salem seems stuck.
So the city spokesperson who declined to speak with us added via email, the city is helping people in other ways, including implementing a rental assistance program that she says over the last few years has helped hundreds. And I want to point out, we reached out to every sitting member of Salem City Council, and Nordyke was the only one who could meet with us. But one other got back. His name is Jim Lewis, and he was out of town last week. But today I talked with him via phone, and specifically, I wanted to drill down on why he thinks this sit-lie ordinance would hold up in court, because one, others have been challenged and defeated, and two, there's a Ninth Circuit Court of Appeals ruling recently upheld by the U.S. Supreme Court that in short says cities can't criminalize people for sleeping, sitting, or lying outside. So why would this one work? Here's what he said.
Well, two things. One, the proposed ordinance does not have any criminal aspects to it. Basically the sit and lie ordinance would allow the police to go up to folks on the sidewalk and say you can't really be here between certain hours during the day. The Ninth Circuit and with the Supreme Court decision basically says you can't really do that until you have a place for them to go, and that's the connection to the we'll call the day shelter.
All right. So in other words, while the promise of all those shelter beds is still a flop, the city is banking this new plan on a new shelter space. And Lewis says he doesn't know if a spot has been ID'd. But again, we could find out at that city council meeting on Monday. I'll let you know what happens.
We've said it before, mail-in voting is great, except when you drop off your ballot early and then your candidate drops out. Plus, we're in week 2 of the Republican walkout, and ad campaigns are starting to target lawmakers in more moderate districts. A look at who's behind this when the story continues.
And if you vote for me, then I promise you we won't just win Oregon. We'll win this nomination. We will win this general election. And you and I together, we will change this country and we'll change the world. Thank you, Portland.
Welcome back. Keep sending in your questions and your comments about the show so far. We do read them here, and we'll address some of them at the end of the show. And of course, use the hashtag #HeyDan, or if you want, Hey Maggie, because it'll be hilarious when Dan comes back. All right, you've probably heard it's Super Tuesday. You just saw all the coverage on Nightly News, and you can get all the results at kgw.com. So we're not really going to talk about it too much here, but this is a good time to remind you about Washington's and Oregon's primaries. Washington's is a week from today, Tuesday, March 10th. And you could call it sort of like a mini Super Tuesday because 5 other states will also be voting. Oregon's primary is one of the last ones. It's not until May 19th. So if you're in Washington, you already have your ballot, and you might have really gotten it together, filled it out, and already mailed it in. Go you. You would think, because, and this is where procrastinators win, for some, voting early might not have paid off after all. See, ballots were sent out more than a week ago, and since then, Pete Buttigieg, Amy Klobuchar, and Tom Steyer have all dropped out. And so far, more than 18% of people have already turned in their ballot. So it's very possible some of those people voted for candidates who aren't in the race anymore. So the big question tonight, can you change your vote? Well, that brings us to our quote of the day. Once you cast a ballot, there's no getting that back. That is what a spokeswoman for King County Elections told the Seattle Times. So unfortunately, you cannot change your vote if you've already sent in your ballot. However, if you filled it out, but you have not sent it in, you still have it on you, you can change your vote. You can do that. There are instructions for that on your ballot. So we are in week 2 of the Republican walkout over cap and trade. And last night, if you missed it, we explained why Republicans from Bend are not part of the walkout. And basically, it's because they come from more moderate districts. You can check that out on KGW's YouTube page. Now, the other moderate districts in the state are near Salem, and Republicans from there are part of the walkout. But last week, our political analyst Len Bergstein told us they are the ones most likely to be swayed to come back. And to that point, he had a prediction.
So that makes Salem a ground zero for some battles. We may see some political advertising right now, at this time, in the next week or so, by interest groups who are trying to kind of galvanize public opinion outside the building against those legislators who may be the ones who are most susceptible to political pressure.
Well, Len, sir, you are a genius, because sure enough, we are seeing ad campaigns targeting specifically Salem area Republicans. A group called No More Costly Walkouts is running ads on TV and on social media telling Republicans to come back. But they're focusing specifically on Senator Denise Bowles and Representative Kim Thatcher, both from districts near Salem. And we saw these ads and we wondered, who specifically is behind this? Who's part of that group? So it's actually a coalition of 18 organizations, some of which you've probably heard of, like the Democratic Party of Oregon, NARAL Pro-Choice Oregon, and Renew Oregon. And of course, we're in an election season, so you're going to start seeing a lot of political ads. You may have already started seeing them. And if you're wondering who's paying for them, or if you have any questions, let us know on Twitter, Facebook, email, and of course, use the hashtag HeyDan. Or when I'm here, you can use Hey Maggie.
It feels like spring. It looks like spring, but the calendar says it's still winter. So what's going on? And an iconic Portland sign is getting a facelift. When the story continues.
Eugene, what a great place. So beautiful. So beautiful. Thank you.
Welcome back, everybody. So Maggie posed the question before the last commercial break about, hey, it's been kind of warm. What's going on with spring? Actually, February was right about average with temperatures, only a 1/10 of a degree off on the plus side. But we've had a couple warm days, including today where we hit 61. But there's been this discussion about meteorological spring versus astronomical, or what you would consider to be the normal start of spring, because meteorological spring began on Sunday, March 1st. Why are there two different definitions of spring or any of the seasons? And here's why. In meteorology, we consider the seasons to begin March 1st, June 1st, September 1st, December 1st. You get the theme here. The reason we do that is basically for analysis, record keeping, and averaging. It's way easier to do that if you have a consistent start date to the season. Now take this year. Normal, or what is technically called astronomical spring, because it's when the sun is making its move over the equator. That's when the seasons begin officially, and that's what we're all used to, right? But those dates change because our calendar is not perfectly in sync with the sun. So take this year. We begin spring on March 20th. We begin summer on June 21st. We begin fall on September 22nd. And then we go back to the 21st in December. And then next year, it'll be different from that. All the years, the seasons start on different dates. And that's very inconsistent. It's hard to work averages when you don't have the same start date. So that's why we have something called meteorological spring. There's also something called different definitions of twilight. Did you know that? There are 3 definitions of twilight. Civil twilight, that's when the sun goes down. Nautical twilight, most stars are visible. You need artificial light for outdoor activity. Then astronomical twilight, it's almost completely dark, but not totally, and all the stars are visible. So there you go. Different definitions, Maggie.
All right, Matt, fascinating. Thank you so much. And hey, if you have a question about the weather, let us know. Matt will answer it. Again, you can ask us on Facebook, Twitter, email, all that. Use the hashtag HeyDan on social, or if you want, Hey Maggie. Self-plug. All right, the next story is about a sign that people frankly love. It's a neon windmill sign on top of Miller Paint on Grand Avenue. You've probably seen it. A store that is celebrating, by the way, its, wait for it, 130th anniversary. I almost said 30th. No, it's 130th. And we did the math for you, and because we're journalists, it took us all day. It was founded in 1890. So it's safe to say it's a Portland institution. That's pretty cool. All right. And so to mark that big milestone, that sign is getting a facelift.
We gave the sign a refresh, all new paint, put the neon back on it, and now we're putting it on the building.
All right, so the sign itself is also super old. It was built and hand painted in the 1930s. Looks good for its age. Well done. Hey, we'll finish the story when we come back. Look, guys, you can see my wires. That's awkward. All right, so we're checking out your social media comments again. You've been using the hashtags HeyDan and Hey Maggie, and we really appreciate it. Judy said, I live in Salem. It's amazing to me that Salem has not been more proactive in addressing homelessness, and then she calls on people in Salem to pay attention because, in her words, several council seats are up. So we appreciate you watching our big story. And then Katrina said, it's been great that you're filling in for Dan. Will he fill in for you when you go on vacation? I guess so. I mean, that's kind of just called doing his job. His name is everywhere. But yeah, we fill in for each other. It's a good team here. Thank you guys so much for watching this story. Tonight, Laurel Porter is standing by for the news at 6:30.